Good evening, everyone. I want to thank the Kennedy Institute and Vicki Kennedy for having me and for that incredible introduction. I'm just so honored to be here tonight. I also want to congratulate New York Governor Cuomo and Massachusetts Governor Baker on receiving the very well-deserved 2020 Edward M. Kennedy Award for Inspired Leadership. Thank you both so much for being here this evening. We are going to talk about leadership, the leadership that you have both shown in a year of crisis. And I just want to start off by letting you both reflect on what this moment and what this award means to you. Governor Cuomo, why don't you begin?
Well, thank you, Kristen, and it means the world. First, to Governor Baker, congratulations. To Bruce Pursley, God bless you and thank you for all the work you do. My friend Martin Luther King III, thank you for your inspiring words. He's a great help to New York in many, many different ways. He's working with us now on the census. And to Vicki Kennedy, thank you from all of us for keeping the dream alive and the inspiration alive. It is so important today. I learned so much from Senator Kennedy. I had the good fortune to be working in Washington when he was in the Senate. I was the Secretary of Housing and Urban Development. His lesson of substance first, excuse me, it's about making accomplishments. It's about getting results. He was extraordinary. He also taught me about politics. I was the Assistant Secretary of HUD. And we were giving out community development block grant money. As Governor Baker knows, it's very important to government. And Senator Kennedy and myself as an assistant secretary, we drove all across Massachusetts, stopping at all the different towns and small cities, giving out those grants. And the senator was so gracious with his time and the retail, if you will, the personal nature of politics. And how he exuded that. The American flag that is over my shoulder. Senator Kennedy sent me that the day I was confirmed by the U.S. Senate as HUD Secretary with a note that said, this is the flag that flew over the Capitol the day you were confirmed. Those kinds of gestures, that kind of humanity, that the senator incorporated, the humanity, the substance, the results, and the touch, the charisma. Never forgetting it's about the people and the people you represent. He was extraordinary, and we miss him. But his lessons should go forward for the next generation, and that's what this institute does, and Vicki Kennedy does, and we need it so much. So it's truly my honor.
His lessons, his legacy, certainly, I think, looming large over this moment and certainly this evening. Governor Baker, for you, what does this moment, what does this award mean for you?
Well, obviously, I'm deeply grateful to Vicki and to the folks at the EMK Institute as well for this award and what it stands for and represents. And I've always thought of Senator Kennedy as one of those people who was able to work both sides and did it on almost every major piece of legislation that he got passed. There was always sort of the name, his name on one side of it and his Republican ally or co-conspirator on the other. And in this particular time, finding a way to collaborate and work with others that you may not agree with on everything is in some respects a science that I think is incredibly important, and we probably need more of it. And for me, that's a huge part of what makes this so special. I do want to tell one quick story since Governor Cuomo reminded me of one of my own. 15 years ago or so, I agreed to serve on the Rose Kennedy Greenway Conservancy Board. This is when I was in the private sector, and I was nominated to serve by then Governor Mitt Romney. And I was sitting at home having dinner with my family on a Friday night. It was probably 7 or 8 o'clock, and the phone rings. And my daughter, who at that point in time was probably about 8, answered the phone. And she answers the phone, and she comes over. She says, "Dad, Senator Kennedy's on the phone." And I was sure it was just one of my friends goofing on my daughter. And I went over and I answered the phone, and I said, "Who's this?" And at the other end of the phone, you could hear that very traditional and completely familiar Kennedy accent saying, "This is Senator Ted Kennedy." And it was. And that speaks to Governor Cuomo's comment about the fact that that he understood how important it was to make politics personal and to make policy personal. And he touched people in that way every day throughout the course of his career. And for that reason, I'm deeply honored by this.
What a great memory. And I appreciate so much that you talk about Senator Kennedy's appreciation for adherence to bipartisanship. And of course, that underscores this evening the fact that this award is going to both the Democrat and Republican governor. So again, congratulations to you both. I want to talk about leadership as we look forward in the COVID crisis. And you are perhaps facing what is arguably one of the toughest leadership challenges to date. The fact that we have nearly 300,000 deaths from COVID in this country, the fact that the vaccine is on the horizon and there is so much optimism. How do you encourage people and convince people to keep holding on just a little bit longer? Governor Baker, let me start with you. We're approaching the holidays.
Well, I think the first thing I'd say is that you have to spend time in front of them. And I probably had press conferences for 80 or 90 days in a row back in the spring, and I'm still doing 3 or 4 a week. And obviously Governor Cuomo knows the value of that particular activity as well as anybody in delivering a message and trying to hold people's attention. I think what I would say is that I do believe that most people, at least in Massachusetts, most of the time are doing the right thing. And that was demonstrated by all the travel data we saw around how many people were driving and flying and taking buses and trains to various places over the Thanksgiving holiday. But I do think the most important thing people need to do now is recognize and understand that this is no time to let up. And yes, there's a vaccine coming, and that's a wonderful achievement on the part of the companies and the government here in the U.S. But we are in the midst of a major league surge across the country, and it's critically important for our families, for our healthcare workers, for our senior citizens, and for so many others that we take the advice and guidance around what we as people, as individuals, can do around wearing masks and staying out of groups, especially groups that involve people you don't spend time with on a daily basis, and recognizing and understanding that, and while those things are difficult and we've all been doing them for a long time, they work. And that's a big part of why we need to keep doing that and doing it for all those people who have to take care of people when they get sick and the families of those who get sick.
Governor Cuomo, same question to you. How do you plan to convince the people of your state to keep holding on, to keep adhering to the social distance guidelines, to listen to what the CDC has to say? As you know, people want to see their relatives over the holidays. And that is one of the biggest concerns for health professionals, that very simple act of spending the holidays with your loved ones could increase the cases of COVID even more.
Yeah, no, Kristen, you're exactly right. And I think Governor Baker's right. You communicate. I did an event with Dr. Fauci yesterday. You try to bring smart people with credibility to the table. But it's hard because it's counterinstinctive. You're saying to people during the holidays, don't socialize. We're social beings. That's what we do. The migration, the spreading is now coming from what we call living room spread. To tell a person you're not safe in your own home, you're not safe with your family, right? 50% of the spread is asymptomatic. You can be with your brother and your sister and in your own home, which is your safe cocoon, your safe zone, but they can infect you. It's very, very hard. But you try the best you can with communication, and then you have to set, leadership is sometimes doing what's unpopular and setting restrictions for society that are in their best interest, even though they are not popular. And they are not popular right now. People want to be able to go to a restaurant, want to be able to go to a bar, and this is the season. But leadership is doing what's hard when it's right, and that's part of the function also.
And speaking of some of those very hard choices, I want to ask both of you about what we may see moving forward in your state. Governor Cuomo, I know that you have talked about the possibility that you may need to close in-person dining yet again. What is the likelihood that that's going to happen? What are the barometers you're looking for, and what are the other potential steps you might need to take in coming weeks?
Yeah, Kristen, I think we have to get through the last abyss. The last abyss is pre-critical mass for the vaccine, which they estimate anywhere from June to September, right? Before the vaccine really hits critical mass. And we have to make sure we don't overwhelm the hospital capacity before that. So if there's a gap between hitting maximum hospital capacity and critical mass for the vaccine, that's what we're afraid of. But there are certain absolutes. If you are going to overwhelm your hospitals and overwhelm the hospital capacity, and that was Italy, that means people will die unnecessarily. That means people will die on gurneys and hallways because they didn't get to a doctor. If that's going to happen, you hit that point and you're measuring and you get near that point, then you have to shut down. As painful as it sounds, we hope it doesn't happen, and you try to slow the spread by the holiday cautions. But Thanksgiving started 37 days of the holiday season. We're now coming into Christmas and Hanukkah and Kwanzaa, and then you have New Year's Eve, and then you have New Year's Day. These are all big social events. We just hope people are responsible enough so we don't overwhelm the hospitals and we make it to the critical mass of the vaccine. But if you overwhelm the hospitals, then yes, we'd have to close down again.
Governor Baker, to you, what steps might you be considering? I know that one of the things that you have returned to is only elective surgeries in hospitals to make sure you have enough capacity for COVID patients.
Yeah, there are two big issues associated with this that I think are kind of fundamental to the way we think about it. The first is, how are we doing in terms of providing support for testing resources, PPE, guidance, advice, and all the rest for folks who take care of seniors? One of the big lessons we learned from the first round of this was how important it was to have a really aggressive testing program and a really aggressive auditing and sort of accountability program in place for all of our folks in the long-term care space. And combined with a significant amount of resource that we put on the table to support that community, they're in a much better place than they were before. But that's going to continue to be one of the things we pay the most attention to, because in addition to hospital capacity, the population that is clearly most at risk when it comes to COVID are the folks over the age of 70. I used to have a meal every week with my dad until February of this past year. And my dad turned 92 in June. He's in a congregate care community, and I didn't see him for 100 days. And I still haven't had a meal with him. And I make an appointment like everybody else does when I want to go see him. And it's a very controlled environment under very controlled circumstances with a limited amount of time that I can spend with him. And for me and for so many others, this is a nightmare. I just don't even know how else to describe it. And my best friend actually lost his mom in the midst of the early stages of all this. And he and his wife and their kids didn't really have a chance to say goodbye. And I keep coming back to these kinds of things when I want to deliver a message to people about why it's important to take this seriously and to understand that, you know, these are really harsh trade-offs. The whole question about safety for vulnerable populations and what that means in terms of isolation and a lack of opportunity to be with people that they love during the holidays, to get back to Governor Cuomo's point, is the trade-off against putting people in a position where they could be at risk of a terrible set of circumstances. And between that and the decisions you have to make about the rules and the guidance around businesses and what can be open and how it should be open and all the rest. We've never, by the way, I mean, we have never permitted the reopening of bars since March. And you know, I hear all the time from the patrons, appropriately. I hear from the owners, many of whom have, these are family businesses, many of them, and they've been in 2 or 3 generations of families. And, some of them have survived, the Great Depression, World War I, World War II. And COVID may be the thing and the rules that we've put in place may be the thing that puts them out. These are really hard decisions, and they are, I think what I would say is that I'm humble enough to recognize that this virus just punches me in the gut every single day with respect to what we know and how it works. But we try really hard to make sure that the decisions that we make try and balance the competing interests and concerns that exist here, which are profound and significant.
And I'm so sorry for your friend's loss. In your telling of how this has impacted you personally, it occurs to me, and I want to talk about the vaccine and vaccine distribution in a moment, but both of you have throughout this crisis been very honest and candid with the people of your state about how it is impacting you personally. Governor Cuomo, why is that an important part of leadership? Why has that been part of how you have dealt with this moment?
Well, Kristen, I think it gets to the overall point, skepticism about government, cynicism about government, distrust, hyper politics has never been as bad as it is today. Both Massachusetts and New York are Democratic and Republican states, right? We're not what they call vanilla states. We're not all of one party. So when you're governing, I'm speaking to Democrats, I'm speaking to Republicans every day. You're dealing with an issue that really needs consensus, community action, social action. So you have to somehow try to get out of this trap of politics. Well, you're just a Republican, of course, you're going to say whatever Trump says. Well, you're a Democrat, you're just going to say whatever the opposite of Trump. You have to get past that. And you have to have credibility with people in a way that, I don't know, that government officials have had credibility in decades. Just think about what you're asking people to do. Stay home, don't go to school, close your business, don't go to a restaurant. When has government ever had the authority to say that or do that, such dramatic action? And in truth, we don't have the authority to enforce it. Massachusetts doesn't have enough troopers. The state of New York doesn't have enough troopers to go out and enforce all these orders. So it really is social action. It really is trying to communicate to the people of your state the facts that will bring them to a conclusion. Because it's not a government-enforced situation. It's truly social action. And people relate to people at the end of the day. I want to connect with you, not as a governor, not as a politician. This is all personal, and you're afraid, and you're nervous, and you want truth, and you want information that you can hold on to. You're out of control in your life. And you desperately want some type of control. And for me, the best way to communicate that connection, that authenticity, is relating how I'm dealing with this personally. You're worried about your kids, you're worried about your family, you're worried about your health, your mother. So am I. So am I. I have the same concern, the same feelings. I'm living the same pain every day that you are. And that's true. That is true. And if you can establish that in this unique moment, that's why we're all in this, right? That's the most beautiful government-citizen relationship. I represent you, I represent your interest, I'm telling you the truth and the facts, and then we will decide what to do. That was the relationship through COVID. And to the extent it worked, it was a beautiful thing. We have more to do, and it's getting harder, COVID fatigue, et cetera. But I think that was the only way to do it on a personal level.
You talk about trust, and that is going to be so critical to the distribution of the vaccine. Governor Baker, first of all, are you confident you're going to be able to get the vaccine distributed efficiently throughout your state? And how do you instill that trust? Exactly what Governor Cuomo is talking about.
So I just say two things about this, Kristen. The first is we're the number one state in the country in terms of the percentage of people who get the flu vaccine every year. We have a pretty solid structure in place for distributing vaccines, and I certainly believe that structure will be tested by both the volume and complexity of a 2-dose shot and some of the other issues that come with this COVID vaccine. But we have a very strong and very creative and rigorous healthcare community here as well, and a lot of folks who are very committed to getting this thing done and getting it done well. I think the part of the way we tried to address the question about both how to distribute the early doses and also to just message about the vaccine generally was we put together an advisory group, and that advisory group has infectious disease experts and hospital leaders, but it's also got community leaders, faith leaders, and people from various communities around the Commonwealth who are leading voices in those communities who served on that advisory board, so that as we roll this out and as we represent what our plan is with respect to how to stage the distribution, we're going to have a lot of people from a lot of walks of life with a lot of different experiences able to talk about the fact that they participated in the dialogue and the discussion about how to set this up and why this is, especially for healthcare workers and vulnerable populations, a good thing.
I think you're right. I think
Which is my way of creating trust with people other than necessarily just the government bureaucrat.
Yeah, and I think you're right. I think that hearing from all of those people is going to be such a critical part of the process. I'm glad you raised that. Governor Cuomo, same question to you. How confident are you that you will be able to get the vaccine distributed throughout your state efficiently? And the toughest question, perhaps, when do you think life is going to get back to normal for the people of your state?
Yeah. Operationally, I think we'll be fine on the distribution. We've COVID testing. We've been making the machine work. I think we're going to have a real issue with trust. All the polls say it already. We need to hit 75 to 85% of the population to have critical mass for the vaccine, right? For the vaccine to work. We now have 50% of Americans who say they won't take the vaccine, they don't trust it. And there's a number of reasons. I think there was a distrust about the Trump administration and the way they politicized the public health system, hangover from hydroxychloroquine, et cetera. So some people don't trust the approval process. And then some people are nervous about the vaccine itself. But those numbers are very high. They're even higher among the Black community and the brown community, Latinos. And I think we're going to have to make special efforts to develop trust in the Black and Latino community. I think we're going to have to make special efforts to distribute the vaccine to poor communities, public housing, Black communities, brown communities. I think there has been discrimination in the healthcare system for many years that was exposed during COVID. Why is the death rate from COVID twice as high in the Black community, 1.5 times in the brown community? Because they didn't have those underlying healthcare services. They had more underlying illnesses. Why is the infection rate nearly double in the Black community and the brown community? We had less COVID testing. A higher percentage of essential workers were Black and brown. So I think from a social equity, social justice point of view, we have to bring that forward with the vaccine process. If you just let the healthcare infrastructure do it, there will be inequality in the vaccine. Richer, whiter communities will have more access. We're going to have to make a special effort to make sure we're building trust and we have that delivery mechanism in Black, brown, poorer communities.
And I think that that has been such a critical part of this year as well, the realization that communities of color have been disproportionately impacted by COVID. And of course, both of you know that in addition to dealing with the COVID crisis, this country has been dealing with the crisis of what happened in the wake of George Floyd's death. The fact that you had protesters come out all across the country and call for change, call for racial justice, not just in our healthcare system, but throughout all echelons of this society. So, Governor Cuomo, let me just follow up with you right there. And if you would speak to the next generation, the younger generations, what can you do in this next year to really try to show leadership and to address the concerns of those protesters?
Yeah. Lesson of Senator Kennedy. Voice the opposition, energize the electorate. They're right. They're right. What happened to George Floyd was disgusting and un-American. And by the way, it wasn't just Mr. Floyd. It's been 20 years. It's Eric Garner. It goes back to the abuse of Rodney King. It's Amadou Diallo. It hit critical mass with the Floyd murder. But there was basic criminal justice reform that had to happen for a long time. So they are right, I believe, the protesters. But Senator Kennedy was also very good about the second part of the equation, which is it's not enough to voice the opposition. You need to change the system and reform and bring results. That's the point of the raising the decibel of the opposition, is to actually motivate government and force government change for results. What we're doing in New York is I've ordered every police department in this state, 500, to sit down with the community, have a community collaborative, and restructure what public safety is today. Because it is a dated system. And we've reformed education, we've reformed healthcare, but criminal justice in many ways and policing in many ways has remained static. Not every 911 call should be answered with a gun. Not every 911 call is about an arrest. It's mental health, it's substance abuse, it's domestic violence. And restructuring that public safety function, literally in society, I think is the positive result that should come forward now. And that's taking that popular opposition and using the energy to make real government change.
Governor Baker, same question to you. What is your message to the next generation about what you're going to do to show leadership in this dual crisis that the country is facing?
So we had been actually working on a law enforcement certification and transparency and accountability bill for almost a year with our colleagues in the Black and Latino Legislative Caucus prior to all this. And we ended up filing that bill, excuse me, and finishing it. It would have been done and filed earlier in the year, but the COVID thing distracted us for a while. But we ended up filing that bill right around the time the tragic incidents, and they were incidents, there's more than one, including George Floyd, but there were several others as well, all occurred. And our legislature has been working this issue through the summer and sent us a bill a few days ago, which we're currently in the process of reviewing. But there's no question, as Governor Cuomo said, that, you know, on both the training side and on the sort of accreditation, accountability, transparency side, there's a lot that needs to get done here. And as I said, this was something we were working on before all this happened. And the other stuff we've been working on is trying to dramatically expand and increase opportunities for Black and Brown-owned businesses to do business with the Commonwealth. We're a big purchaser. We buy a lot of stuff. Sometimes we tend to buy a lot of stuff through one vendor, which makes it hard for smaller businesses to play. One of the things we're talking about incorporating into our budget submission, and we currently have a reform plan to change the way our whole supplier diversity operation works before the legislature, which I'm hoping will become law by the end of this year, is to significantly both invest in and expand our capacity to seek out and work with minority-owned businesses in the Commonwealth, because we buy a lot of stuff, and we should be able to figure out a way to make sure that those kinds of companies have an opportunity to play and to play successfully in that arena, because that will create opportunity, and that will create jobs, and it will create wealth. And we also, just one final thing, we had a big last piece of an old state hospital property that went out to bid and for redevelopment. And the company that ended up winning that bid was a consortium that was led by a local development firm that was owned by several Black men. And it will be the largest development project in state history to be led by a Black-owned development company. And I think the way you move this needle is by doing things that demonstrate legitimate and significant forward progress. And they come in a variety of different ways, but I think for all of us, we sort of feel at this point that it's got to be intentional and it's got to show results.
Well, we are out of time, and not to go into debate moderator mode, I'm just going to give you both 10 seconds to make one final closing comment. Governor Cuomo.
I miss Senator Ted Kennedy. I miss his leadership. I miss his spirit. I miss his personality. I miss his record of accomplishments. I miss his laugh. I miss his personal touch, the charisma, and the inspiration. He was inspirational as a government leader. And God bless everyone involved in the Institute for keeping that alive. He was one of the greats, and a role model for many of us, I know for me. So thank everyone who's participated to keep more young people learning about that important lesson.
Governor Baker.
So I would just start by saying again how grateful I am, and in some respects how humbled I am by this. There are a lot of people who work this COVID issue in Massachusetts in both the public and the private sector, and at the municipal level and at the state level, and it is very much a team effort. And I tend to think sometimes that the people who sit at the top of the organizational chart get credit for a lot of the work gets done by a lot of people, and that's certainly true as far as I'm concerned with regard to this. We still have a ways to go. I sort of feel like COVID is a hurricane that just never goes away. But I do think in many respects, the approach that Senator Kennedy took to his work, which was to build coalitions, find common ground, and move the ball, is exactly the way good policy and good government happens. And I've never been around an issue like this one, where it hasn't been more important to have a big coalition of the willing to move the ball. And I think that's something that he would appreciate. And I'm also enormously grateful to be receiving this award.
Well, I congratulate you both on the award, on the work that you have done. We wish you luck and Godspeed in these months ahead. And it has just been such an incredible honor to have this discussion with both of you. So thank you, and thank you again to the Kennedy Institute and to Vicki Kennedy for having us all.
Thank you, Kristen.
Thank you, Kristen.